Okay, so our next presentation comes from Michelle Maeda, and she is with the Children with Special Health Needs branch. She is a pediatric dietitian, and she's going to walk you through steps in this important transition between health for healthcare for our kids, between pediatric and adult life. So I'm going to pull up the slides for you here, Michelle. Okay.
Oh.
Am I in the very beginning?
Okay.
There we go.
All right. Okay, thanks, Amanda. So I'm Michelle, and I'm here to talk to you today about transitioning to adult healthcare. Now, the last two times the Footsteps event was on Zoom, I did talk about transitioning to adult healthcare, but I kind of had a focus on individuals with childhood diseases and the difficulties and barriers that they might face getting adult healthcare. So for this talk today, I wanted to change it up a little bit. And so I wanted to do touch points that we can use to educate our youth about the need for access to healthcare and how to efficiently get adult healthcare. So can I get the next slide? Okay, so in the US, we need healthcare insurance because why? Healthcare is expensive. So I just kind of Googled these numbers, but I don't think that they're kind of far off. So just an example, if you had a broken bone, if you just needed it set and cast, it would be a couple $1,000s. But if you needed surgery, it'll be $17,000 to $35,000. And I don't think that that's wrong. Medications, okay, antibiotics, generic, not too bad. But once you start getting to brand name or specialty medications like Ozempic, then it gets really, really expensive. And we don't even want to go to if you need to get hospitalized. So one day in intensive care, 5,000 to 11,000. And that's variable because it depends on how severe your condition is, right? If you need ventilator support, etc. And I can almost guarantee that those values don't include medication, the labs, and the doctor fees, because you know how those are all piecemealed. So, I know I'm speaking to the choir here. If you have a known medical condition, you pretty much know that you need medical insurance. But if you ever come across a person that's like, I'm healthy, I don't need medical insurance, remind them it just takes one medical emergency to put them into a sinkhole of debt, or even worse, that they should access healthcare, but they don't, and then they suffer consequences because of that. Okay, so the next slide. So we need insurance. How do we get it? So here in the US, we have two basic ways to get insurance. One is private insurance, which is you usually pay yourself or you get it through your employer, or we have public insurance, which is state federally funded. And in Hawaii, that's our Quest Medicaid. Now, in Hawaii, we are blessed to be one of the states with one of the highest percentage of insured individuals. And I do think that it's because of two main facts. For our private insurance, back from the 1970s, we have had our Hawaii prepaid healthcare law. And it's gone through a couple changes, but basically it mandates that employers are required to offer health insurance to employees working a half time or more. You won't find that necessarily on the mainland. Another part that kind of bolsters our private insurance level of insured individuals is in 2010, President Obama passed the Affordable Care Act. And as of right now, this is still in effect, and that children can stay on their parents' insurance until their 26th birthday. Because before that, you got kicked off once you were 18, or you had to prove that you were a full-time student, not even a part-time student, to stay on your parents' insurance until they're 24. Now, the second big reason why we have such a high level of insured individuals in Hawaii is with our public insurance, our Quest Medicaid, we have a very generous family income eligibility limit for kids, our keiki, from 0 to 18. So for us, it's 300% poverty or less. less than 300% poverty. I'm sorry. And that's really high because in other states, it could be 180% poverty or maybe as low as 133% poverty. But now remember, once an individual is 18 years of age, right, they are legally an adult. And so if they're applying for the first time at 18, the income requirement drops down to 133% poverty. Okay, next slide. So if we look at both types of insurance, right, there's pros and cons. And with private insurance, the biggest pro is that it is basically accepted very widely. Most providers, if you have private insurance, that they would accept you. But the biggest con is that it's pretty high cost, right? Even if you get your insurance through your employer, a lot of times you still have to pay a premium, not to mention the co-pays and the deductibles. And so if you have a known medical condition that needs ongoing services, those can add up pretty fast. And also, the coverage of services can vary depending on the plan that you're on. When we look at Quest Medicaid, I mean, the biggest pro is that if you meet their eligibility guidelines for financial eligibility, you pretty much have no premiums or copays or deductibles. So the cost is basically none. They have a very broad coverage of services, but the biggest con is you may find that providers may not accept or may only accept a certain number of Quest Medicaid individuals. And you'll see this more often as you get into adults. Now, when we talk about insurance and we look, right, the cost factor is a big thing. So it's a pretty no-brainer that if you had, can I have the next slide, please? So if you're in this situation where your family was over income when their child was under 18 years of age and you could not apply for Quest Medicaid because it was over the 300% poverty, remember, once your adult child reaches 18 years of age, they are legally considered an adult and they are considered a family of one. So your family income no longer applies. But just like Mr. D said prior, you need to make sure that they meet the income eligibility guidelines. So they do not have any assets over the $2,000 limit. And that's when I would encourage you, to use the programs available like the ABLE account or the special needs trust to make sure that they are eligible for these benefits. And this includes SSI. Now, even if your 18-year-old applies for Medicaid, and if they're still covered under your private insurance plan, and let's say it's not a big deal. You pay for a family plan anyway. So if they stay on, it's not like it's a big monetary difference monthly. They can stay on your private insurance plan until they're 26 years of age. And so up to then, they can have two insurances. Now, the other scenario I just kind of wanted to bring up is, let's say as a family, you have and you pay for your private insurance through your employer. But for whatever reason, your private insurance doesn't cover all the services that your special needs child needs, and your family income meets the eligibility income for Quest Medicaid, so under 300% poverty, you might want to consider, speaking to either a navigator or a Medicaid outreach provider to see how you can kind of maneuver to maybe get your child onto Quest Medicaid. And I would say this is not a light thing to do because it's spooky if you have a special needs child. It's like, oh, you're going to kick them off your private insurance and then, hope that Quest Medicaid kicks in. So, you need to really think about it. But I have, for instance, I have kids that have big congenital heart defects. And in the past, right, Kapiolani didn't do a lot of open heart surgeries. So they had to fly to the mainland, either to San Diego or to Stanford. Now, with at least HMSA, and I'm not picking on HMSA, it's just because they are the largest private insured company in Hawaii. But private HMSA does not pay for airfare, even if it's medically necessary for your child to go to the mainland. And they won't pay for even the child's airfare, whereas Quest Medicaid will pay for airfare for the child and for a guardian. They also don't pay for lodging or ground transportation, which for Quest Medicaid, that's covered. So that's like a big thing to get covered. Also, a lot of times, again, private HMSA does not pay for habilitative care. So if your individual didn't have this skill, they won't pay for the child to develop it. And this is really speech therapy. Private HMSA does not pay for speech therapy. So again, if this is something you wanted to consider, again, speak to a navigator or a outreach provider. So again, we have now we have insurance. Can I have the next slide? Who do we see? So a lot of times I think of medical care and I think of three broad categories. So the first category is your primary care provider. And so this should be your go-to person. In essence, when you're an adult, this could be a family practice doctor who sees individuals from zero birth to old age. It could be an internal medicine doctor who specializes in adult conditions. Or if you're a female, it could be your OBGYN. Sorry. Now, your primary care provider really acts like your pediatrician. So we call this your medical home. They should know all about your medical conditions. They should know your situation. And they should be like the guide to guide you through what you need in terms of your medical services. They are also kind of your gatekeeper. So if you need referrals to specialists, it's usually your primary care provider who would be the one to do this, or therapy like OT, PT, speech. I would encourage you, once you find your primary care provider, to really develop this relationship, right? Because if you think, okay, your pediatrician was able to know you for like 18 or 21 years, and sometimes they become so close, especially if you have a special needs child, you see them so often, they're almost like family, right? And you want to kind of encourage this with your adult provider, because really think of it. I mean, your adult provider could see you for 30, 40 years. That's pretty significant. And also remember, all insurances pay for an annual physical. It's not only for kids, for adults too. We can go for an annual physical. This would be an opportune time for you to develop that relationship with your primary care provider. So you're not only seeing them in crisis mode, it's not only when you're sick. So the second level of care, I look at urgent care. So these are basically walk-in clinics. They're available all around the community. They usually have longer hours of operation, like over the weekend. And so, when you can't see your primary care provider and it's something that's not an emergency, but you want to get seen, like you have a bad cold or flu, or you hurt your leg and you want to make sure that it's not broken, urgent care is a good choice. Remember though, right? You walk in, you see who you're going to see. There's no guarantee. You can't request a specific physician. They may or may not have any of your background medical conditions or medical information. And they're going to really focus on just treating the condition that you're being seen for that day, right? If you ever talk to people, I mean, I would really discourage them from using urgent care as your primary medical services, just because, right, you want somebody to be able to guide you. With you going and seeing whoever is there is no continuity of care. And lastly, we have the emergency room, right? So this is for emergencies, life-threatening situations where, it's after hours, you want to get seen right away, right? So these are shortness of breath, high fever in a young infant, you can have chest pain, lethargy, etc. If you are unsure of whether or not you should go to the emergency room, a lot of times insurance companies or even your primary care provider, they might have like a nurse hotline that you can call, so you can kind of give them your symptoms and they can give you guidance. Or maybe this can wait till tomorrow. Oh no, you should just go to the emergency room. Okay, so the next slide. Okay, so now we have established who kind of we need to see. What kind of information do we need to bring to the visit? So remember, now, if your adult child turns 18, right, they are considered an adult, and they, in the government's eyes, because they are an adult, they're looking at them to make all the decisions regarding every aspect of their life. And so if you are still wanting to be a part of this decision-making process, you need to make sure that you have your legal documentation done. And so there's different levels of legal documentation. So one is legal guardianship. Now, this is the most restrictive because basically it takes away all the deciding rights for that individual. And now I'm not a lawyer and I'm not really an expert on this in this topic, but from what I understand, if the individual is not able to consent or doesn't have the capacity to consent, then legal guardianship would be something that maybe you need to look to pursue. And this is done through the courts. A lot of times people hire lawyers, which is very costly. You can do it by yourself, but it is very difficult to do. I think it's a lot of time consuming and there's a lot of moving parts. So it's a very complicated thing to go through. The next level is power of attorney. And again, when you get power of attorney, the individual needs to consent to you being their power of attorney. So again, they need to have the capacity to consent. This does not require a lawyer, and there's different types of power of attorney. I think Amanda mentioned when she was looking at the timeline that there's the power of attorney for education. So in this case, you're looking at the power of attorney for medical power of attorney. And this is just a form, doesn't need a lawyer. I think it just needs to be notarized. And in Hawaii, we have something else called the surrogate decision maker for healthcare. And so I think they put into the chat box, if you look under our Footsteps to Transition website, we have under the turning 18 money and health, I think it's called. We have a template for this surrogate decision maker for healthcare, and also the information accompanying it, the Uniform Healthcare Decision Act. So basically, it's when you kind of determine that the individual is unable to make decisions for healthcare. When you're using the template, they have a section where every individual that was involved in this decision, not only deciding that the individual is unable to make decisions, but also selecting the surrogate. And one of those persons should be a physician, because they would have to deem the individual incapacitated so that you would be able to be elected as a surrogate. And really, I think this was made, it was back in 1999 for our elderly population, if they're starting to show signs of dementia and needing a surrogate for healthcare. Other information that we need to think to look at and bring to the medical, to the doctor's visit would be medical history. And we talked in the past about individual medical history, but I would also like to touch on past family history. So could I have next slide? So in the past, I've talked about having a portable health record. And we think that this is really important because, when you go to see a new provider, you cannot assume that they would have all the information that they would need. A lot of times, those things fall through. So having the information there would just make that visit flow a little quicker. Now, since the last time I did this talk, there has been a lot more templates available for a portable medical record that is geared more towards an individual who has a childhood condition. It's not only for an elderly person who has dementia or stroke, you know what I mean? Like for this one, it's for a child neurology foundation. It is not geared for an adult with a stroke or anything like that, right? It's looking at genetic chromosomal issues, a viral exposure, and then even the adaptive functioning domains. The next slide, this is another one that I found from the Division of Specialized Care for Children in Illinois, Chicago, Illinois. And again, this is really geared for individuals who are medically fragile. You know, we also talked about in the past, so you can peruse and pick a portable medical record that meets your needs. Go to the next slide. We also talked about, in the main adult hospitals, like Polymomy, Straub, the Queens Medical Centers, they utilize the electronic medical record called Epic. And so that allows you to have access to your patient portal, which is MyChart. And in the MyChart, they pretty much expanded what you can access. So for myself, I know I can access the actual notes that the physicians generate from my visits. So if you wanted to share this with a new provider, that could be something. Hopefully, if they are one of the hospitals or he's a provider that is linked to Epic, they would be able to get your medical records ahead of time if you gave permission. Could I have the next slide? Or if you're seeing a provider that doesn't have Epic at all, you have the ability through your MyChart to share. So you can actually share, it's going to be your portal with that provider so they can have access to your information. Okay, could I have the next slide? So the other part that I didn't talk about in the past was past family history. Because, as an adult provider, they would look at your past family history as almost like a roadmap to look at potential things that might happen in the future. And this is up and above the current medical conditions that you have. So kind of knowing what your parents and siblings, what their medical conditions are, with the extended family, I would say at least knowing your grandparents and uncle, aunties, major medical issues that they have. Because like in my case, just for an example, at a young age, I kind of knew that type 2 diabetes ran really strongly in my family. So like my great grandma, and especially in the females. So my great grandmother, my grandmother, my mother, my auntie, and my sister, they all got type 2 diabetes by the time they were 40. So for myself, right, I did not want that. And so I tried to exercise diligently, keep my weight down, try to eat right. And so I'm going to be 60 this year. And so far, I'm not diagnosed with type 2 diabetes yet. So, those kind of interventions, they really do work. Now, can I have the next slide? Is there a next slide? So Spin made that beautiful infographic, right? That talked about the timeline. And, when you looked at where insurance and health transition went, it was kind of at 18 years of age. But really, we're not only looking at getting them an adult provider, we would like to teach our youth how to independently take care of their own health. So really health transition can start at a very young age, and you probably did, right? So anytime when you taught your child how to brush their teeth, when you're teaching them, what they should eat, fruits and vegetables are good. When you're teaching them to go out and try to get some exercise, all those things, try to instill in them health behaviors that will keep them, help them be a healthy adult. And so, could I have the next slide? In my Children with Special Health Needs program, we developed this little handy dandy guide, My Path to Adult Care. And it talks about little things that you can start doing with your youth to kind of help them be independent, and little steps that they can take to take more responsibility for your health. And realize that no matter where you started in this timeline, it's always a great place to start because it's basically a journey. And next slide. And that is my talk. If they have any questions.
Fantastic. Thank you so much, Michelle. And I was sharing, so I wasn't I wasn't watching the chat, but I know there's several in here. Let's see. There's a question That one's for SSA, it looks like. After 15 years of having dual health coverage, Ohana dropped my son and gave the reason due to dual coverage and nothing else. I was told you drop told I was told you drop HMSA, then you can get Ohana again. Why would the state want to pay the entire cost versus partial? Also, HMSA doesn't cover prescriptions for diapers and wipes.
Yeah, private HMSA, they do not provide that kind of stuff. You know, I don't know why they would drop that, uh, because, if your son is an adult, they should qualify. They should income qualify for Quest Medicaid. I don't understand, because that is actually the only way you can get dual coverage nowadays, right? Is that you would have to um income qualify and be able to be on your is he I wonder if he is on mom's insurance as a disabled adult, but that shouldn't, I don't know, that shouldn't, I don't think that that shouldn't matter. I don't know. Yeah,
Yeah,
that's a
I agree,
big thing.
Michelle.
Yeah,
It's a
I
big
don't,
thing.
yeah.
We had my husband retired, and so our HMSA was a considered private once you retire from the county, and theirs is a little different. He couldn't stay on until 26, regardless of his school. He only takes one or two classes a semester, and that's not a full-time student. And HMSA dropped him. And thank goodness we had Quest, but then there was a lot of hoo-ha about the Quest and his G-tube supplies and all of that. It was kind of a mess. And so we had to have him certified as an adult with a disability through HMSA. And it's basically just a paper that a doctor can sign to get that back to them. And they were able to reinstate him on the plan, as long as he was certified disabled adult. So
No,
maybe talk to your HMSA.
but he shouldn't have been dropped off Solo's insurance anyway, because he can stay on until 26. That's federally mandated
for
through
for
ACA.
public insurance, but retirement insurance is private.
Oh, I
That's how they can
see.
do it. So look and
I
see kind of how
see.
they look at your HMSA and what kind they think it is. Maybe there's something in there, but we were able to get him back on because we got him certified disabled, which I wasn't happy with because who wants to have their kids certified disabled? But it worked and now he's back on. So I would take a look at that. Call your HMSA people. You can appeal. They've got representatives there that you can talk to about trying to get them back on. Someone asked, where do I start to become a surrogate decision maker? Is it a paper you then keep and give to the healthcare providers?
Yeah, I think so. Susan's on. She could answer that more so, because she actually did it. Susan, would you?
It's very easy. There was a form that was developed by the University of Hawaii Elder Care Project. And unless there is a family member that is opposed to you being the surrogate, it hasn't been a problem at all. You just fill out the form, and anytime anybody asks you, you give them a copy of it.
And that form is on our Footsteps to Transition website. The link was put into the chat.
Yep, definitely. And we were able to get a power of attorney for Ikaika for our son when he turned 18, and we got it notarized, and he was there, and he signs it as well. So then when we go to a doctor's office, if they are weary about talking to us because he's an adult, we can show him, or Ikaika can show him, my son, the power of attorney that says, yes, I actually want you to talk to my parents. Sometimes you don't even need that POA. If your adult child can say, I want you to talk to my parents, or I want my parents to be in the room, or to have conversations or help me make decisions, often the doctors will take that as well, from the patient themselves. So Michelle, this was really impactful. Thank you so much. It's a big part of our transition from our kids being kids to our kids being adult kids. And it's a process that we have to go through, all of us. So thank you for sharing that.